So if you're watching this video, it means you and I have talked about the fact that you have a rotator cuff tear, and we've talked about doing a repair. The rotator cuff, just to recap, is a group of 4 muscles and their tendons that attach to the humerus, which is the long bone in the arm. It allows you to position your arm in space and certainly to do sporting activities or anything over your head. If you have a rotator cuff tear, most of the time the pain and also the dysfunction are what bring you to see the doctor and what allows us to diagnose the rotator cuff as torn. There are other associated pathologies that may go along with a rotator cuff tear, such as biceps, tendinitis, or degeneration, as also an AC joint problem. And if you and I have discussed those in the office, those would be part of the surgery that we're about to perform. So the surgery is performed as an outpatient, which means you'll come to the hospital and go home the same day. It's done under what we call regional anesthesia, which means we'll numb your arm up, and then you'll get sedation through an IV so you'll feel as if you're sleeping. The surgery itself takes about an hour to an hour and a half. During the surgery, I will look inside with small incisions and a camera and anchor the rotator cuff back down to the bone with some plastic anchors and suture, which will allow me to tie the tendon back to the bone while it heals there. You'll wake up in the recovery room. Your arm will still be numb, usually for several hours. You'll go home with some good pain medication, which you will require day and night for several weeks, and thereafter only at night usually. The narcotics, which are the Percocet usually that we send you home with, can cause things like constipation or sedation, so you have to be careful and can't drive during the period that you're taking them. You'll see me in the office between 10 and 14 days where I'll take out the sutures and check your range of motion, and you'll have already started physical therapy and we'll continue it twice a week. I'll see you again at 6 weeks, we'll check your range of motion, and I'll let you out of the sling, and then we'll continue physical therapy 2 times a week, again until I see you at 3 months. At 3 months, we'll check your range of motion again, also your strength. You'll progress with physical therapy, and I'll see you a final time, usually between 4 and 6 months, to make sure you have enough strength to get back to full sport and activity.